Meeting to order. Stand for the invocation. Father, we're here with grateful hearts. We pray that you bless our meeting. May everything that we say and do be pleasing to you and in accordance with your will. In Jesus' name, amen.
Here.
Julia Coates. Joe Deere. Kevin Easley. Lisa Hall. Johnny Kidwell. Darrell Legg. Cody Poindexter. Joshua Sam. Mike Shambaugh. Melvina Shotpouch. E.O. Smith. Kendessa Teehee. Victoria Vasquez. We have a quorum.
Thank you, Shelley. Entertain a motion to approve the minutes. All those in favor?
Aye.
Motion passes. On to reports, Mr. George Vallier from Claremore Service Unit. Thank you for coming, George.
Oh, thank you. Good afternoon. Everybody hear me okay?
Yeah.
You have my report in your packet. I won't go if you have questions about that. But we've got, last week we had our semi-annual governing board meeting with the area office last Wednesday. That went well. They came down to the hospital and we met all day for that. We had a group go to Tulsa. The Tulsa Public Schools had a powwow this last weekend, and they called us, and we sent a group over to set up a booth for the kids, and they went over and took information about obesity, water safety, healthy eating, different things, and handed it out and said they had over 70 folks come by the booth. So a real successful weekend over there working with Tulsa Public Schools. We've also had a couple of outings with working with Cherokee Nation Public Health there at the hospital. The public health nurses, we had a employee health fair handing out resources to employees, National HIV Day, and Diabetic Awareness Day. So we've had a lot of good results there. And then lastly, we had a Daisy Award winner, which is a National Nursing Award that honors nurses for their compassion in clinical care. Andrea Carpitcher received that award last month for her work in nursing. So, kudos to her. Any questions?
Questions for George? Sasha?
Good afternoon.
Hi.
I just wanted to make a comment and say congratulations to Ms. Carpitcher. That is a tremendous accolade.
Mm-hmm.
So congratulations to your staff, to your OB department. I'm an OB nurse, so I'm very passionate about that. So congratulations to your team. Great work, and thank you for sharing with all of us.
Oh, thank you. I'll pass that on. Thank you.
Any other questions for George? Looks like we're good, George. Thank
you.
Okay. Up next will be Dr. Steve Jones with Cherokee Nation Services. But I see Wayne Caldwell is going to be subbing for Dr. Jones. Welcome, Wayne.
Thank you, Mr. Chair. Council, thank you for having me today. A few points from the report that's in your packet from the February 2024. Highlight, 83 babies were delivered at Hastings Hospital in the month of February. That's a short month, so that's a big number. Think about that. 167 prescriptions filled across the health system, new and refill prescriptions for the month of February. Moving into page 3 of your report that is in front of you. Make a note to go to the second table that you have on there. It's called Ambulatory Care Visits Monthly Report. You'll see across the bar graph that you have there a slight increase in all the outpatient health services numbers there, which is great. We'll continue to open up access for the patients. Down at the bottom, you'll see the third-party revenue combined. As you'll see, we're trending okay on that. We're still working through our clearinghouse issues that we've had in regards to the third-party revenue. Moving into the fourth page that is in your report, the The provider recruitment, as you'll see there, Cherokee Nation Health Services provider vacancy rate stays at 7%. As you'll see in coming months, in March into April, we do have some commitments from providers that will be joining our health system, and we're excited about that. Some in Salisaw and in Tahlequah, various locations, so we're excited. Last, but definitely not least, the referral approval rate, 98% with Contract Health Services. 2 notes, just want you all to be aware of. Dr. Harp sent a good reminder to our team today, reminding our constituents and patients that, you see the green and yellow film on y'all's cars. It's getting thicker by the day if you don't go to the car wash, and we are available in our same-day areas to serve these patients if they're, have allergies that arise. And last but not least, if you have any questions or concerns for me, please reach out at any time. So, Mr. Chair, that's all I have to report.
Joe?
Hey, Wayne, got some calls from some elders about medical transport, like their doctors. The medical transport would tell them they don't have a ride for them, so they need to call their doctors back to rearrange that appointment. But sometimes those appointments, as we all know, 3-6 months. Can we check into that, what the deal is with transport?
Absolutely. If we can offline after this and give me some examples, I can dive into those exact ones and figure out what's going on.
Okay.
So, no problem at all.
All right, thanks.
Danny?
Wayne, good to have you today. Are all the clinics going to 10-hour days? I know the one in Salina that Councilor Shambaugh and I were talking. I know a lot of people thought that they're only going to be open 4 days, and I mean, we didn't get any update on what was happening, so I don't really have an idea of what's going on.
Yes, sir. So we are working to the transition of extended hours. That doesn't mean that we're closing down the clinic in a given day, right? We will still offer those services, just extended hours for those, for the patients that maybe work till 5 or need to come in a little bit earlier. So we're just extending the hours. We're not cutting any days out of there. So we are transitioning to a 4-10 schedule for the team. Yes.
Thank you.
Cody?
Yes, can you hang around afterwards?
Absolutely.
For a few minutes, thank you.
No problem.
Okay, I see no other questions. We may have, bring you back to the podium when we discuss this act. May bring you back.
Yes, sir.
Okay, thank you. Thank you, Wayne.
Thank you.
Hope this is on. Good afternoon. It's good to see you all again. Hope you're having a great day. You have our public health report in front of you. We're pretty busy right now. We have about 14 CDC grants that all come due. The re-ups all come due at the same time. So we have a lot of people writing and working on making sure we acquire those grants again. We're also working on Farmers Market, which will be starting May 1st. Those benefits will be going out. They'll be, instead of being vouchers this year, they're going to be loaded onto an EBT type card for the participants for the farmers markets. We've been working hard on acquiring more farmers. I know that we've increased by at least 12 or 13 during this last month. We're obviously still working on summer EBT at all of our locations and starting wings. So if there's any questions that you have about anything that's in the report, I'm happy to answer or address any of those. Questions? Who's got one?
Danny?
I did see on your farmer's market report where you've got several, like you said, you've got several of them signed up. Do they have something where they just swipe that, or how in the world do they get?
For us to spend the benefits?
Yes, yes.
Yeah.
How does that?
So last year, it was our first year, so we did actual paper vouchers. This year, it will be loaded on either their WIC card, or there's an app on the phone that the WIC participants can use at the farmer's market as well. So, yeah. Anybody else?
Any others?
All right.
Thank you, Lisa.
Thank you.
Okay, old business, none pending. Under new business, number 1, who would take that for us? Joe?
This is an act repealing Chapter 3, Sections 301 through 304 of Title 63 of the Cherokee Nation Code Annotated. Put that in form of a motion.
Okay, open for discussion now. It's in your booklet on tab 1, basically repealing the 90-day prescription mandate act. Mr. Caldwell, could you come to the podium, please? Could you kind of tell us the rationale
Absolutely.
regarding repealing the 90-day.
Absolutely. So we, as a health system, we do lean on our medical staff to drive the vision and the prescribing practices of our health system. The physicians or providers throughout the health system made the decision that, we wanted to ensure that, we were providing safe practices to the patients that we serve. There was prescription waste that were potentially going on. And I would find this to be a normal standard across, other health organizations of a 30-day prescription. This is not black and white. I think that's a very clear thing that we need to talk about. If there's needs that arise for these patients, the guidance that was sent out in the mail to them, I think there was around 6,500 letters that went out. They can contact their local health center for this request and work through their primary care, or they can contact our patient experience team, and we can work through those avenues as well. To date, there have been some one-off requests, and we've been able to facilitate these at the local level. So if you have some that are out there that are outstanding, we'd love to, get in the middle of those and figure out what's going on.
Okay.
We also, another addition to that, we're trying to get where we need to be on our refill center. We have a central refill center, and, that is always a very good, a good tool to use for your constituents. It is a little bit cumbersome to get where you need to be on it, but with a little training and a little support, and our patient experience team are allowed to help those constituents that this need arises. But I've referenced it as good as Amazon. I use it personally for myself, and it delivers right to your doorstep, and your prescriptions are there, so.
Any more discussion? Sasha?
Good afternoon, Wayne.
Hello.
Hope I sound a little bit better from the last time we visited. I've been contacted by some constituents concerning the change from 90 to 30 day. A lot of them, and I have some copies of some emails that they're receiving from their insurance companies concerned with the change. That's recommending that they go ahead and switch to a different pharmacy to obtain a 90-day refill versus the 30-day. And those are coming from major insurance companies.
Okay.
But also, I have constituents, because of the change, they're having difficulty obtaining their medications. Me personally, witnessing from some of our clinics, the strain that it's having on our pharmacy staff. The patients were lined up from the window, outside the pharmacy, down the hall, down to the next hall. And that was 3 out of the 5 days last week, and then several the week before. And just standing in line personally and hearing them talk, they've had to come back multiple days and are going without their medication now because the pharmacy staff, from what I'm hearing, are going from 90-day refills to 30. They're tripling their workload, increased work stress, they're getting burnout, they're looking for other jobs. I know we looked at our medical staff, what their recommendations are. Did we talk to our pharmacy staff that's dealing with this day in and day out? Did we survey them? Because they too matter. And I want to retain our staff. I want them to enjoy coming to work. But they're not experiencing that, and that's a concern for me. As a nurse, we advocate for our patients, but we also advocate for our staff. So I have a hard time supporting this change from 90 to 30. I know it may benefit some, that we were seeing supposedly some non-compliance. I would like to see that data before we act on changing this. I know when they implemented this change, they worked very hard on getting this changed into our health system, which it's not done just Cherokee Nation, it's done nationwide. But I feel like it's doing a disservice to our patients. If it's a new medication, I understand starting out with a 30-day prescription and seeing how they tolerate. Bring them back for a 30-day refill or a 30-day follow-up evaluation and see how they're tolerating that medication. Then from there, we can do a 90-day. Then you're not wasting your medication. That seems like a procedure policy change versus system-wide.
Yeah, good comments, Counselor. I think there was a very cohesive team of all disciplines across the health system that were at the table when this decision was made. We are monitoring the quantities of which the local pharmacies are having to process. To date, I'm unaware of any backlog, and if you do have patients that are going without their meds, please send them to me. You have my number. You can call me day or night, and I'm available to assist them. We have a great pharmacy staff. We have a leader that is very attuned with the quantities and processing of the prescriptions daily. Again, I want to reiterate, we do not dictate medicine in regards to prescribing practices. That is what our providers do. And so we are here to support their decisions on moving to the 30-day prescriptions. And it is not black and white. I want to reiterate that. If there's patients that need this, that don't have the means to get to where they need to be, we can facilitate that, and all that is a visit with their primary care physician, and they can make these changes in the system. So we can facilitate any need that arises.
Julia? I don't think so.
Yeah, I saw a lot of hands earlier, that's why I asked. Not being local, I don't know what the experience in the actual clinics has been and all of that, but I know that for at-large citizens that are receiving prescriptions, they're coming by mail. And so I guess my presumption was that that's an option also for anybody, is it not? And my experience out in California, I'm with Kaiser, and a large health system, granted, but I had envisioned that this was going in that direction because it's a 30-day prescription. That's all you get. I have 3 refills before it has to go back to my provider to have additional refills approved. They send me a text, like a week before I'm eligible to refill it. I can either go online or call or respond to the text. I've got 3 different ways that I can refill it. I can go pick it up in person, or they can send it to me by mail, and it's an incredibly efficient system. And so I guess that's what I was envisioning this was trying to head toward. Can you talk a little bit about what the vision is in that regard?
I'm glad you brought that up because that wasn't in front of my brain today. But we are transitioning to a new pharmacy package. We are currently with Etrabie, which is a Cerner product. They are sunsetting that, which is, they're doing away with it, and we're moving to McKesson. That is kind of the golden standard out there is McKesson. We are currently in the implementation phase, very early implementation phase, and we are hopeful as we go through this that we will be as Councilor Coates was pointing out, it'll be an app-based refill, reminder, et cetera. Hopeful to what some of you all have seen yourselves or constituents of the new text notification that we sent out for your appointment reminders. I don't know if any of you all have signed up for that, but it's a very great, and we have seen a large decrease in our no-shows across the health system, which means more access to patients, which means more refills that are to come. But we are monitoring that, and we have a good team around that to make sure we're compliant with the provider's orders. So,
Eddie?
Yeah, Wayne, of course, I wasn't on the council back when they passed this, so I'm not really understanding what the resolution was that we passed back in 2014 and what the difference is now. So, I mean, is there any way to get a copy of that or to, why? So the resolution says that we have to give 90-day prescriptions? Is that what the resolution says, or I'm not understanding what the big deal is with it? So the law means that you have to give a 90-day prescription? So,
You still have the floor, Counselor.
okay, so I guess what I'm trying to ask is why the law needs to be removed if you guys are at your discretion and the physicians are to do what they got to do, why the law needs to be removed? Or the resolution, I guess is what I'm asking.
yeah. Mr. Chair, I think, this is this may be more of a notification to the council of this change. I think that's when Dr. Jones or whomever brought that forward. And this is just, a question, I guess, for this body that's coming forward.
Thank you, Wayne. You're doing an excellent job. But Councilor Callison, so the 90-day legislation was passed quite some time ago. And it was really a time before today where we're so much better and efficient at issuing prescriptions and getting them to the citizens via mail. So I think that was part of the, maybe the reasoning why that legislation was passed at that time. But again, today, we're much more efficient, and if you order it, you're going to get it in the mail, or you can come to the pharmacy to do the drive-through, or you can come in and pick it up. But again, I want to refer to something back to what Mr. Coldwell said, is that we believe that we are being responsible by repealing this act for our citizens for various reasons. For one, we should not legislate how a provider provides care to our citizens by the medications like that. Think of this, for one example, think of this. Let's say a citizen has blood pressure medicine, and let's say they have a 90-day supply of that. Let's say 30 days into it, the provider changes it for some reason. Maybe the citizen forgets. Now they're doubling up on medications. That could be a very dangerous situation. That's just one example of why we believe there needs to be a change, and there are no doubt many others. But we appreciate the consideration, and please, I know others have questions. And I'll step out of the way. Thank you for the time, Mr. Chair.
Junior?
My question is, on some of my elder ladies that call, they get the letter, and then they turn on the news, and it's talking on the news that there's going to be a lot of prescription medicines going to be shortage. Has that got anything to do with that? I tell them it's not, but am I telling them right?
You are, and the shortage of medications ebbs and flows, right? But to date, I'm unaware of any medications that we're unable to meet the needs of that have been prescribed. So, I mean, you again, I would refer them to their health center. If they have questions that arise, we will fulfill that med. But I'm unaware of any meds that we aren't able to meet the need of at this time.
Okay. Well, that's good. So I can tell,
Yeah.
because they get the little groups going in, they say,
Oh,
well,
yeah.
they're going to cut us and do away with it.
Yeah, again,
Okay.
reference them to their health center, or reference them to the letter where the patient experience team is. They have the majority of the answers. If not, they'll contact me directly, and we'll work through that. Okay?
Thank you.
Johnny?
Thank you, Mr. Chair. Wayne, thanks for coming in today. Just a couple of questions. Whenever you mentioned earlier about this change maybe helping us out with waste, so some citizens in whatever way, do we have any data that supports that, or is this anecdotal evidence? Do we just think that, okay, we're prescribing 90 days and they use 30, so the rest of it got flushed down the toilet, we're assuming? Is that basically what that is, or do we have data that has come back that said that we are really wasting X amount of pharmaceuticals?
I'm unaware of any clear-cut data that's available for that, but I would just say, we're trying to work on normal prescribing practices or standard prescribing practices, and that would be 30-day.
Okay, another question for you, real quick. This 30-day, and then being able to make a phone call to refill this prescription, or go online and refill that prescription. You mentioned earlier that sometimes depending on the medicine, which I want to ask you about in just a second, depending on the type of prescription, maybe they need to see their primary care. Are there any of those is this a new formulary that we're shifting to, or is it just a different branding? Or because I know we've had questions of formulary, is that what we're shifting to as part of the impetus of this, what Dr. Coates was talking about earlier?
The formulary
or what did you call that?
The formulary will maintain the current system. That's what will kind of keep the log of the medications that are approved by our medical staff. To Counselor Coates' points, we have a software/database that we process all of our prescriptions through, and we currently use Etrabie, and we're transitioning to McKesson, which most of the health systems or local pharmacies use McKesson. So we're excited about that. We're excited about that transition.
Good. I'm glad to hear that. If people think that's better. My question about going back to the medical primary care provider, are there any medicines that we have right now that require our personnel to go back and meet in person to renew these prescriptions?
Let me get you a list. I would imagine there is, but I don't have that exclusive list.
Because that becomes a problem. Right. I mean, obviously, if we're, for my constituency and Dr. Coates' constituency, if they're living in, Oregon, and now they're required to come back every 30 days to renew that's a little bit beyond most people's capacity. And I understand that everyone gets to make choices, and I'm not saying that we need to, help out everybody in the world here, but, shifting from that 90 days to 30 could be a a negative impact on some. I'd just like to get an idea on what those might be, that's
Yep.
all, before we
Yeah.
move forward.
Yeah, we'll dig into those, and as always, it's not white and black, right? And if there's situations that arise like this,
Yeah.
please reach out and we'll work through those.
Yeah, I've heard you say it's not black and white a few times, but it is, right? I mean, it is kind of black and white for us on this side, on the legislative side. Now, I know that with this being, because I honestly, forgive my ignorance, I didn't know that we had this 90-day law in place. I'm also of the idea with Chief of Staff there that we don't necessarily want to be mandating how our physicians provide care. I get that, so don't think that that's not lost on me as well. But there were some medicines in the past recently that we dropped down to 30 days, right? Am I correct to assume that was in violation of this law that we're attempting to get rid of today?
I'm not familiar with those exact instances, but
Well, I think insulin was one. I think there were some others that we dropped down to 30 days, policy-wise, which leads me to, I'm not saying that, people have broken the law here. What I'm saying is I understand the overall policy that we shouldn't be mandating laws that directly impact how our physicians provide medications to the people that they are there. So I'm just saying that that's not lost on me, but we should kind of take a look at this in a holistic manner and see how best to move forward. I think there's a few people that have more discussion, but Chair, I appreciate you letting me ask a few and show my ignorance on some, but thank you, sir.
thank you, Counselor.
Thank you, Counselor. Kevin?
Was this a request by the physicians to change this from 90 to 30? Or where did this kind of
We
originate?
identified it as a group, we were looking at our prescribing practices across the health system and our volumes that we were seeing. And we had identified that there was, the standard across, the country is 30-day prescriptions. And we realized that, and again, we've already been prescribing 30-day medications for some time. This is just moving back, to a standard of 30 moving forward. So it was a team made of nursing, pharmacists, physicians, and leadership also.
So if we were to repeal this and a doctor wanted to exercise discretion to prescribe something beyond 30 days, could a doctor still do that?
100%. Yes, that is part of this.
Mr. Chair, could I?
Sure.
And I like your question, Counselor Easley. I mean, really, we could handle this through policy. If we wanted to do 30 days, 60 days, 90 days, 120 days, whatever that is, we can take care of that through our health policies. And Wayne and other ones sit on the governing board, and they look at policies, they look at all sorts of things on a monthly basis. So they do a really fantastic job of understanding those pieces. Thank you, Mr. Chair.
And then this question, thank you. This question was already asked. I just want to elaborate on it. Talking about the potential for waste. Is there any kind of numbers or anything that you could present to us, be it if we tabled this for 30 days or something, which would show even just an average of what waste would be based upon a 90-day prescription, so we have an idea of maybe what the financial impact is? I mean, I would be curious to know that if that's out there.
We can dive in. I think one of the challenges is, and this is kind of getting a little in the weeds on this, but one of the challenges, I don't know that a lot of patients self-report back, right, when they may be prescribed another medication of sort within that 90 days, let's say. But let me offline with the team and see what options are out there.
Yeah, my concern would just be I don't want to take away discretion from doctors.
Yeah, absolutely.
I mean, I'm not a doctor, but I know in my day-to-day life, I want as much discretion as possible.
Candace?
To be clear, the initial legislation said that where there is a 90-day prescription or more, individual citizens would be provided with a 90-day supply. It is not a mandate that doctors prescribe 90 days that they prescribe 90 days at a time. I think there has been a little bit lost in this discussion that there is some idea that doctors are being required to prescribe 90 days or more. That's not what the legislation says. The legislation says where 90 days or more have been prescribed, that a 90-day supply should be provided. So for instance, like myself, you know, I've been on birth control for a number of years that I'm not comfortable stating. However, I get a 90-day supply of that at a time. It's something I've been on for a very long time. My doctor and I are comfortable with a year-long prescription at a time where I get a 90-day supply, you know, where I get a quarterly supply essentially. So I think that, you know, if we're talking about things like insulin, as Mr. Caldwell mentioned, this isn't necessarily a black and white issue. We're talking about a vast diversity and a hugely broad array of prescription drugs. So there's nothing in that legislation that says a doctor has to prescribe 90 days. It does not say that. That's not what the legislation says. And Councilor Hall and I were talking about how in that previous legislative meeting that there were counselors that felt very, very passionate about having a 90-day supply of medication available to people, because I understand, you know, we live in this day and age where you can get your prescriptions mailed to you. But for instance, if a prescription needs to be refrigerated, you know, how long is that going to sit on your doorstep? Can you feel comfortable taking that, knowing it's been sitting on your doorstep all day long? We currently have a meeting that's scheduled in Tulsa for the reduction of mail delivery for people who are being served by the Tulsa area. So in light of like the United States Postal Service being dialed back on some of their functions, talk about going from delivery 6 days a week to sometimes delivery 5 days a week. You know, can we always count on the fact that our mail is going to get those prescription drugs to us in a timely manner, in an orderly manner? Do I have the ability to take off work for when the pharmacy's open to go down and sit in line every 30 days instead of every 90 days? You know, these are all things that I think are fair to consider, and those are things that the initial group of counselors considered whenever they pass this legislation, which again is not a mandate on how a doctor should provide care. So I think one of my issues with this is that it sounds like the letters already went out. Right? So the letters have been out, like the bell's kind of already been rung, and now we have individuals coming in here, and this is I think you do a wonderful job, Mr. Caldwell. I'm not trying to hold your feet to the fire on this at all, but now we have this ask for repeal coming in after the fact. So we're talking, I think that the cart got before the horse here, and so I have an issue with that. And so these are all the reasons why I'm voting no today on this.
Joe?
Since I brought this up as a motion, I was thinking about just making a motion to table it for a month, because there seems a lot of clarity that needs to be done, a lot of questions, and obviously Wayne got thrown into the fire. So I would make a motion to just move it till next month.
Making a motion.
Yep. Or can we pull it?
Let's
Yeah.
hear further discussion, and I'll address your motion.
Okay.
Johnny?
Yes.
I didn't get a hair second.
Okay.
Okay, there's not a second on the table right yet.
No, that's fine.
Okay, Johnny, did you have something?
I would, Mr. Chair. I don't, we've talked a little bit about this today. In looking at in what we're trying to pull back, it's pretty basic for the purpose of effective accommodation, timely accessible medication for health patients, Cherokee Nation, 90-day prescriptions, drug distributions are hereby mandated. That's what it says. I mean, we're basically, that's what the old law, the 2013 law says. In my world, that's bad law anyway. I mean, I find myself in support of this this resolution or this change that we have on the floor today, mainly because of what I said earlier. I don't think we should be dictating that to our doctors anyway. And it's pretty black and white if anybody's read it. It's a mandation. It's 90 days. So I find myself in favor. So as we work through this, thank you.
Speaker?
I'm going to agree with Councilman Kidwell. It is mandated, it is law. But the problem is, when you do these things, everybody has to be on that page. And I think what we're doing now cleans up a bit of that where we are restricting. And in the past, I'm not going to get into the past, but from here on out, we know that we're going to be on the same page. Probably weren't on the same page in the past a little bit, and I think this cleans that up, and it needs to be cleaned up. Because like you said, we are not dictating what a doctor does, but at the same time, we need to protect ourselves from how we may have been doing things in the past that may not have been in accordance with this. It needs to be cleaned up, and that's why I'm supporting it.
Julia?
Okay. We don't always remember what our previous votes were, but Councilor Kidwell, in pulling this up, pointed out to me that I voted no on the original 90-day mandate some years ago. So it only makes sense that I will vote yes on repealing it today. And I don't recall why or what the discussion was, but I do agree with the comments that we're micromanaging here something. But I do want to ask about the 30-day. I think this is exactly the kind of thing that should not be legislated. This should be left at the level of policy. This should be left in a with more flexibility, right? For physicians to deal with each patient case by case. And to be able to make adjustments as medications or as the need may require. But I do want to ask about the policy. The policy is not mandating a 30-day, is it? Or
It is not.
It's just saying that's what we're going to generally try for.
Correct.
But obviously, there are going to be, specific cases where something else is going to work better. And unlike the law that is currently on the books, leaving it at the level of policy will allow it to be more open to make those rapid
Absolutely.
shifts, should the physician need to do that.
Absolutely.
So that's why I do support the repeal of this.
Thank you for those comments, Counselor.
Joe?
Hey, Wayne, I've heard a couple of things. Everybody knows it's Autism Awareness Month. And me having an autistic son are fully aware of meds. They still do the televideo, right? Like if they need to, like for California, like if they need to just televideo and say, how's everything going? And then sign off and then they send them their meds.
We do have telemedicine.
They still do that,
services,
right?
yes.
Telemedicine
Yeah.
is the right
It's a
word.
case-by-case basis.
Yeah, because that's what we do with him. So my son Yona is on 90 days, but it actually is under the requirement of 30 days. But now they've got it because we don't want to tell the doctors what to do, but we also don't want them after 30 days saying, oh, we forgot it. You didn't have an appointment.
Mm-hmm.
And then you can try to get an appointment. So he is on the 90 days. And when that 90-day cycle comes by, they just televideo, they send us a Zoom, boom, it takes us literally 3 to 5 minutes. So I just want to make sure for our at-large people that we're not having to ship them and try to correspond to all that.
Yeah,
So-
this has nothing to do with the change in our operations
Okay.
in regards to telemedicine.
So I didn't want there to be any shortage, but yeah, I'm in support of it, and I was just trying to do it for sake of time because there was a lot of questions. So, but that was why, just making sure you had that televideo. All right, that's all I had,
Are you
Chair.
withdrawing your table motion?
Yeah, we can do that.
You withdraw?
Yeah.
Who? Speaker?
And real quick, I deal with the pharmacy a lot too, with my medications I take. So I know that they have the leeway when I come and say, hey, I'm low on such and such, and they pull me up and get my date of birth and do all that stuff, and they go, oh, wait, you're not, this is ran out. and they'll go, hey, let us call the doctor and make sure. They do that. They call the doctor, make sure, that they're working with us in case something goes wrong, or the pharmacy and Jay does, to make sure that you don't leave without medication if you need it. So that's another thing, it doesn't, we can't take away those kinds of things from our employees where it does hurt our patients. And it's been my experience that happens a lot, and they make the call and they get it. The doctor okays it for another X amount of months. And that's great that this doesn't take away that from our physicians. That's all I have.
Junior?
I know our pharmacy does a great job of taking care of the elders, like if they run out, they can't get in there, they'll work real good to get them enough till they can get to see the doctors. But I know I'm gonna get asked, how many days will their ordering date change? I mean, before they can order, 2 days, 3 days, or 1?
Yeah, they typically can ask, I believe it might be 7 days prior to their prescription running out that they can ask for a refill. I need to clarify that. I'm not sure on exactly that, so.
Any others? Melvina?
I can say for Sam Hyder Clinic, they don't have a problem. I don't see no big lines or nothing, or even outside people lined up trying to get medicine. But I do have seen, knowing some people giving medicine away in parking lot of Walmart when they have 90-day supply. I have seen that with my own eyes. They do.
Kevin?
Yeah, I just want to say, as I kind of originally stated to Chief of Staff, my concern was discretion. Wanted to make sure that our doctors were in favor of it and that they still had the discretion under this. Reviewing that, I believe that a repeal will give our doctors more discretion than they have right now. So I will be voting yes on it.
Sasha?
Sorry, just to follow up. So on this, you can assure me that the patients, should they want a 90-day, they can request a 90-day.
Correct. Through their primary care physician, correct.
Okay.
They can.
And to follow up on Councilman Deere's on telemedicine, correct me if I'm wrong, I recall as far as billing goes with telemedicine, we cannot bill for telemedicine for our at-large that are outside the reservation. Has that changed?
There's a lot of times that's dictated by the payer, right, on that thing, and we also have to look at where the physicians are licensed in also. So if you give me specific examples, we can look into that, but there are varying services available such as behavioral health, and there are some primary care physician services also available via telemedicine. This act that is before you changes nothing for our telemedicine patients that we have.
How about our staffing for pharmacy that are experiencing this influx? How are we relieving that strain? Or do we have vacancies? Are we adding additional staff to help offset this load that they're experiencing?
Yeah, we're leaning on our pharmacy leader to kind of guide us on that. We are pretty well staffed right now. Of course, in any discipline across 2,700 employees, we're going to have gaps, right, or vacancies. And so we are watching that. He does look at the throughput. He does look at backlogs. And the good thing about it is, we have a system approach, right? If someone in Veneta has a little time to help process the medication, because there are some IT things that can go on in Veneta that could support the Tahlequah campus, we work those queues together, and there's constant communication across the health system about, hey, we need a little help down here. We're getting slammed in Tahlequah, or hey, we're getting slammed in Cooey, can you help down in Tahlequah? So there's a good dialogue going across the health system. And again, there are waits from time to time, especially in Tahlequah. I'm sure the drive-through is probably what you all hear about a lot. We're working on our efficiency still, right? I think the McKesson software will help us get where we need to be also. But we do have great men and women across the health system showing up daily and serving these patients through the pharmacy services.
Thank you.
Lisa?
What about the physicians? Will they be able to handle the workload as far as those 30-day positions or 30-day prescriptions that are sensitive that they do have to call back and get doctor's approval?
Yes, yes. Luckily, we have a cohesive team that is around every provider that we have. And, the nursing support and, clerical support can nudge the doc and say, hey, I know you're slammed today, but you might need to look in that queue and make sure you process that medication for the patient. So there are times, maybe one's out, right, and the patients don't know when the providers are out. But we have people that are constantly, behind each other and making sure the patients are taken care of. So, any prescription need that arises, please contact me. I'm glad to help.
Any other questions? Cody?
No, I really appreciate you and the work you do. You've helped me so many times with so many situations, and I'm very honest about this. I don't know a lot about healthcare. That is not my background. I'm 27 years old. If that tells you anything, I don't take anything but ibuprofen. If that, so yeah, ibuprofen and Dr. Pepper. That's about what it consists of. And everyone here, we're all, I'd say we're all pretty well at reading legislation, but like I said, my background's not healthcare. I just wish there was more communication before this on hand from somebody from the healthcare perspective to clarify some things up. Just for my ignorance, because that's I'm not an expert at a pharmacy policy. That's not my background. So that's kind of my perspective on it. I'm all for efficiency for our constituents and our citizens. That's the big thing that I'm for. And if it benefits them and benefits are the people that we represent, then that's what I support. So thank you.
Thank you, Council.
Kevin?
Yeah, I just want to echo that. I mean, I'm obviously, already said I'm voting yes on this. I'm going to. But and I'm not harping at you because let me tell you, I'm a big fan of you. You've bailed me out of a lot of situations. And so I'm sure you weren't prepared to stand up for today for as long as you have, and I appreciate that. But maybe take it back to healthcare land that there are 17 votes here. This isn't the Oklahoma House of Representatives where there's 100. Every single one of these votes matters a lot, and we need to be informed before we make these votes, and that's important. And I know I treat my vote with the utmost respect, and everybody else here does too. So whenever something like this comes up, we need to know all the background on it. So, but thank you for everything that you do.
Thank you.
Mike?
Just real quick, I don't know if it wasn't thought that this would be as big as a deal it is. I mean, but in the past, we have had our little meeting side before with the councilman just to let everybody know what's going on. So in the future, we just need to do that because everybody's really responsive to that. And I think we all want the same thing, but we also want to be informed. It's tough to make a game day decision, right in there when you don't know and you're hearing all kinds of different things. So, but I think it's cleared up. And like I said, I'll support you. And I'm one of those people who once in a while they said, you know what, gosh dang it, I got one pill left. Well, life happens and I ain't got no pills left. So, our pharmacies are really good at saying, hey, we'll get you something to get you by till tomorrow or whatever. So, we do have that discrepancy and it doesn't work. So if this helps, then 100%. I just think, and if we see that it doesn't, we need to come back and see, so that's just kind of the way it works. Okay, appreciate you.
Julia?
I appreciate having information in advance, but I also think that we do a lot previous to meetings that really should be sort of done in the meeting so that the public has some view of our process and everything. And that's why I actually think that the discussion that has gone on today has been incredibly valuable. And because the public can watch it, either they have been watching it or they can go back and see it archived. And I have a feeling that it can go a long way towards alleviating concerns that people may have. And if we had all of this information in advance, very likely we wouldn't have had this kind of discussion and brought up exactly the same questions that our constituents are bringing to us. And I also know that, it's hard to anticipate. It's hard. I don't know what my fellow council people know or don't know about various things, and so I'm sure you don't know what we do or don't know either about in advance. And so I do appreciate the time you've taken with us today. I think it's been a really good discussion. And I think it's clarified a lot of things, and I think a lot of us have solidified our votes as a result of it. Thank you.
Thank you, Council.
Okay, there's a motion and a second on the floor.
Who's the second?
Of the original act.
Victoria?
The original motion is Joe Deere and Victoria. The motion to table, there was not a second, so it goes away.
Thank you for the clarification.
Just, Counselor, did you have something to say? Or you just acted like you, Oh, no, not me. Okay, okay. All right, thank you. Okay, I think we're ready to vote on the original act. All those in favor say aye. Aye. Opposed? The motion passes. Okay, any announcements? Next meeting is scheduled for Monday, May 13th at 1. Any more announcements? Motion, second, is there a second? Okay. Huh?